Have you ever wondered about the mysteries that lie within the realm of unexplored diseases? What if we told you about Disease X, a condition that has baffled medical professionals for years? This enigmatic ailment, known as Disease X, has a rich history and a profound impact on those it touches. Its origins and definition, while complex, offer a fascinating insight into the world of medical mysteries. As we delve into the labyrinth of Disease X, prepare for a journey of discovery. Get ready to unravel the enigma of Disease X. Disease X, a term coined by the World Health Organization. But what is it exactly? Let's pull back the curtain on this enigmatic term. Disease X is not a specific illness lurking in the shadows. Rather, it represents a hypothetical disease that could cause a future global pandemic. Picture an unknown pathogen that leaps from animals to humans, or a novel virus that mutates to become highly infectious and deadly. It's the embodiment of the unknown, the unpredictable, the yet to be discovered. It's a placeholder for a pathogen we've yet to encounter, but one we need to prepare for. While it might seem like a concept out of a dystopian novel, it's a serious consideration for global health organizations. Disease X serves as a reminder of our need for vigilance, preparedness, and robust health systems. The concept of Disease X isn't just a fear-mongering tactic, but a real global health concern. Now that we know what Disease X is, let's trace back to its roots. The narrative of Disease X is a fascinating one, as it is not tied to a specific virus or bacteria. Instead, it was conceived by the World Health Organization as a hypothetical pathogen. This strategic decision was made in 2018, when the WHO included Disease X in its blueprint list of priority diseases. The intention was to acknowledge the certainty of an unknown international epidemic in the future, a disease sparked by a biological mutation, or perhaps a leap from animals to humans. This foresight was to ensure that the world was prepared for a yet-to-be-identified disease, which could pose a serious risk to global health. The naming Disease X represents the unknown, encapsulating the unpredictable, mysterious nature of such a threat. Thus, Disease X emerged not from a lab, but from an international consensus on the need for preparedness. The idea of Disease X is frightening, but how much should we actually worry? It's a question that's been lingering around, isn't it? Well, let's delve right into the potential risks. If Disease X were to become a global pandemic, it could pose a significant risk to the world population. We're talking about immense strain on healthcare systems, potentially leading to economic instability and social unrest. But it's not all doom and gloom. The good news is, we're not helpless. There are strategies that can be employed to control such an outbreak. These include early detection systems, robust research to understand the disease, and development of effective treatments and vaccines. It's about global cooperation and swift action. Public education is also crucial, as it empowers individuals to take preventive measures and reduces the risk of transmission. So while Disease X does pose a formidable challenge, we have the tools and knowledge to combat it. While the threat is real, so is our capacity to respond and control. A disease without a face surely poses treatment challenges. But how do we tackle something like Disease X? The complexity of Disease X necessitates a multifaceted approach to treatment. Research is our primary tool. By studying the disease, we can identify its characteristics and develop targeted therapies. Next, surveillance is key. By constantly monitoring the disease's spread and evolution, we can adapt our strategies accordingly. But perhaps the most crucial component of Disease X treatment is global cooperation. Disease X does not recognize borders, and neither should our efforts to combat it. By sharing research, resources, and strategies, we can work together to minimize the impact of Disease X. Of course, prevention is always better than cure. Vaccines, public health measures, and education about risk factors can play a significant role in reducing the incidence of Disease X. In the face of Disease X, our greatest weapon is knowledge and preparedness. Disease X, a mystery, a threat, but also a call to action. We've journeyed through its history, grappled with its potential risks, and learned about the treatments available. We've seen its impact on humanity, understanding that it's not just a medical issue, but a societal one too. The key is to stay informed, stay prepared, and remember that our collective action can make a difference. Remember, Disease X isn't just about fear, it's about fostering global unity in the face of unknown health threats. Stay vigilant, stay informed,